I want to spend a little time talking to you about you, because so often when you're interviewed or you're quoted on the paper, it's always your name and your title, of course, the work that you do, but you're so much more than that. And I think it's really important for our audience, for the public, to learn more about who you are and what it's inspired you to do the work that you do. Entonces, cuéntanos un poquito de ti. ¿Dónde naciste? Where were you born? Where did you grow up? Tell us a little bit about your upbringing.
Of course. I was born in New York. Esta jibarita que está aquí was born from Puerto Rican parents. And then at the age of 6, we went back to Puerto Rico. We're the example, the perfect example, multi-generational family. I went to live with my abuelita. And we were talking about my family, my mom's family, which is a family of 6, living with another family, my tío's family, which is a family of 5, y abuelito y abuelita, which added 2 more individuals, 1 house, 1 bathroom. Hugo, don't ask me how we did it, but we were happy. We were, of course, there was no disparities. We didn't see, everybody had the same thing. Rural area, minimal access to all the amenities that we know. But that was my growing up. Those are my roots. One of the things that I think that shaped me in a way that I can't forget is not having health insurance. My abuelita would suffer. She was a smoker, characteristic of the elders of that age. She used to smoke, and she developed COPD, which is a respiratory condition that, with time, it takes you die from that. So she would start deteriorating physically, clinically, and then we started to receive the impact, because in our Latino family, when one member is sick and you have to take care of that, everybody in the household suffers. So she would go different times at night. We were back and forth to the emergency room, and she didn't really have an insurance for preventative care. So that was the first awakening. I then decided, having seen all that happen, becoming a doctor. So I'm the first one to go to college in my family. I'm the first one to be able to become a medical, go to medical school and then go a residency and do post-training in geriatrics, which I did in internal medicine and then in geriatrics, and then develop a master's, took the classes and obtained my degree in master's in public health afterwards. But that happened later. My abuelita passed away. It was so sad. But she was like the matriarca, that person that even though that she couldn't have, she didn't have the means to develop herself professionally, but her resiliency, the strong person, I'm not giving up, I'm fighting for what is right, was something I think she inherited to the rest of us. So then when I married and I came here to the United States, to Chicago, I did my training in geriatrics, as I mentioned. I became a staff member there, and it was here in Chicago with segregation and marginalizations that I realized that we're not equal. Families that we're not part of that majority. There's difference, and it's starting to take impact and toll, and you see it in life expectancy. This is the first time I ever heard of a difference, racial difference in life expectancy. What does that even mean? Familia, diferencia. Not everybody lives the same amount of time, even though we're in the same space in Chicago. You can cross a street and people on the other side of the street live 30 years more than you. Does that even make sense?
It's mind-boggling.
It doesn't even make sense. So those were the drivers, not only to get my master's in public health, have a little more understanding, but also to start uniting and advocating for changes in policy. Representation came to my mind for the first time, knowing that individuals that speak the same language as you, have the same cultural background, they look like you, can have an effect on outcomes, health outcomes, and individuals be in a better position to even make informed decisions about their health. That I learned as a doctor, and I solidify as a public health provider. So Hugo, in a nutshell, I have a 23-year-old daughter, 24 now. She's in medical school too. She married another student that with her spouse, el yerno mío, is now they're both studying medicine, and this is a strong call for individuals. We need more voices. We need people like you, Hugo. We need healthcare workers, forces there. We need policy makers that look like us. If we don't have the proper representation, we will never change the narrative of the people of a Latino population here in the United States. So this is me in a nutshell. This is my work, my passion, and that I do. I joined Illinois Unidos. You know the rest. This is a very strong advocacy group, more than 400 organizations. We were a couple of days ago in Latino Unity, in the Latino Unity Day in 2023 in Springfield, advocating for Medicaid expansion for the immigrants, including healthcare workers within a certain group that are the productive group. We were having this conversation a couple of minutes ago. But Hugo, this is who I am. This is my love. This is my passion. And I hope that we can see changes. We can start affecting changes. Because I do believe that if we come together as a group, as Latinos unite, we will be able to make a change here.